So I think this is unique in hematology, that there is an active product available, which cannot be produced in large enough amounts to serve the patients in need all over the globe. So we have a shortage of CAR T cells, and the question is whether we can overcome this hurdle. And there are centers which produce their institutional-made CAR T cells, like the Barcelona Center. There's a center in Israel. There's a center in Würzburg. So, and what these centers show, that it's feasible to produce institutional CAR T cells. There are now closed systems available, which allow a short manufacturing time. And you can modify, of course, the culture medium. You can use different receptors. So you are in charge of modulating your product. The time from cell separation to the ready product, the product ready for clinical application is much shorter, and the costs are much lower. So I think big centers probably will consider now, and are considering now, to produce their own CAR T cells. But there's a drawback, because from an approval point of view, these CAR T cells can only be used in clinical studies, because if a product is approved by EMA or FDA, it will be difficult to use it generally for a wide population outside of a clinical study.